So what we're trying to do, clear and evidence-based information in the right way, without the deluge, without a ton of technical language unless it's requested, open communication, inviting the questions, and ensuring the patient feels comfortable and helping the patient make the decision that's right for them. Certainly what I aspire to. I hope I'm good at it, but if I'm not, hopefully somebody will tell me. But I know that this is hard, right? Because it doesn't always work. So you can give some advice to patients maybe on how they manage the relationship so that they are getting what they need from their doc.
I would comment by reviewing your slides today, going back there to the number of combinations, mutations, and then go to the next one, that the number of drugs that have been there. I mean, to me, I think you can write those charts, but wouldn't that be a perfect application for what they call artificial intelligence? So some machine spits out your mutation, and whether you got you there or maybe a younger doctor that can't do it all, and it spits out the personalized treatment plan. That would be nice because it is a complex thing.
So Ralph takes us into, a whole other webinar here, but Ralph is the cutting edge, and AI is really interesting. I will tell you that my daughter now works for an AI company, so I can't tell if this is either the beginning of the rest of civilization or the end. I'm not sure yet. But we have in the United States currently, I will tell you that if you write a question to me in the portal, in the patient portal, I have the option currently of giving you an AI generated answer. It just pops up. I don't have to use it, but I can. And it's fantastic how this is evolving. It doesn't feel like you're talking to the Verizon chatbot anymore, giving you a pleasant answer of like, thank you so much for reaching out. That's a great question. And the patient's annoyed because there's no answer. The answers are actually getting better. And if you type a lot of this into AI, I would say the following. AI does hallucinate. I don't know if you know that term. I learned it from my daughter, but AI does something called hallucinating. And you can, in fact, put in something about your AML, which gives you back very authoritative sounding total junk. But sometimes it's really good. And I do think, Ralph, that this is going to be an absolutely valuable and increasingly used tool for patients to literally type in, what does this mean? What does that mean? But for right now, Dr. Google is not so great, gives a lot of bad information. And I will say that the current bias that I am experiencing for patients is that the news is much more doom and gloom, whatever it spits back at you, than what we are, because it goes right to very unpleasant and challenging survival curves. So I think it's going to be a lot better. I think it's going to hopefully replace us soon. Maybe by next week would be great so that I can go on vacation. But I think you must be very careful currently about using the AI tools, because I think you're going to get sad and anxious rather than happy and uplifted. Charlie, what's your experience in the UK? Are patients jumping on AI and plugging things in and coming up with anything useful?
No, we're not. But I do think Ralph's comments about AI in clinical trials are extremely perceptive, Ralph, because one of the points that I think Gail is making is that it's incumbent on us all to make clinical trial entry much easier. And part of the problem with clinical trial delivery, as Gail and I know to our cost, is it's a highly bureaucratic and clunky process. And I think one of the big opportunities, Ralph, will be to think about how we can use AI to streamline delivery of trials, make it much cheaper, and therefore make it much easier for patients to access. So that's where I see great excitement.
I think that you guys have a sense maybe in the audience, and I think Ralph's family will be giggling. So I think you have a sense of the perfect patient here, right? So I don't know how many of the perfect patients are out there. On the one hand, I think it's paralyzing if you don't feel that your medical team isn't on your side wanting to help you and in supporting you through the process. I think no matter how much education or information there is, we all want that. That when doctors go to see doctors, we want the same thing. You want to feel nurtured, cared for, that somebody's got your back all the time, that somebody's looking out for you, and that solves a lot. But at the same time, hang out on the cutting edge. And it doesn't matter what the disease is. Leukemia is a dangerous one, but there are plenty of other dangerous ones. You want to make sure that your blood pressure, your diabetes, your kidney disease, whatever it is, how do you know that you're on the cutting edge? Part of it is because you're asking the question that, hey, what else is out there? Is this the best thing that I have? For AML, which is a life-threatening diagnosis, obviously the conversation moves faster. What kind of tests are you doing? Do you have a lot of patients like me? Do you treat this a lot? These are important questions. And I think as you hear the answers, you should, as a patient, have an increasing level of confidence. I also think that the docs too, I mean, Ralph's doc did him a solid by saying, hey, I don't treat a ton of this. Go somewhere else where they treat a ton of it and see what they have to say. And I think that is an incredible collaboration in the physician community that is being facilitated by email, by texting, by friendships, crowdsourcing, or call a friend. Hey, I have a patient with this, that, and the other. What do you guys have open over there? We do that all the time, and very collaboratively, I think. Charlie, I think even across countries, very collaboratively. What do you have? What do you have for this? What have you got going on? I think that there are realities that will preclude patients from necessarily traveling all over the place. But I do believe that the internet age and AI and so forth is connecting physicians in a real-time way, in a manner that is incredibly good for patients. And in our professional societies, we have specific examples in under-resourced areas of how just shooting a slide to a colleague or a set of labs to a colleague is saving lives in a way that's very different from even just 10 years ago. Anything to say about that, Charlie?
I was going to say, Gail, that I think your advice at the start of the webinar that patients should work through with their doctors what the standard of care is, what the current treatment options are. And they should also be asking their doctors, have we got all the required diagnostic information? And in AML, it's really, have we got the mutational analysis that will inform my prognostic stratification and my treatment? And clinicians, as you say, Gail, work well together as a team. And so clinicians won't be upset or offended if a patient was to say, are there any other promising treatments out there? You have perhaps described an outcome that's not that encouraging. Do you know of trials that are open in this country? And much of our communication, Gail, is based, isn't it, on informal emails about patients. Because I think everybody is really driven by trying to do the best for patients. So that's an important statement. And I think as we get new treatments coming down the pipe, it's very important that we are working through these national networks to ensure that patients who need them, because often it's quite a small subgroup, actually do have access.